Okay, welcome back. Um, we're going to talk about rhythm interpretation now, and this is a kind of a review uh, to kind of go over the little boxes and all of that. What we're trying to get after when we're doing interpretation on the rhythm, we're trying to get the heart rate. Um, we'll talk about regularity and what that means. We'll talk about sinus and all of that again. But what we want to get is the little tiny boxes are 0.04 seconds. And so each one of those little boxes is what we're going to count. So basically we're multiplying it by 0.04 or 4 times that, the number of boxes that you have. So when we do the intervals, we want to look at the PR interval, the QRS, the width of the QRS complex, and the QT interval. Those are the 3 things we want to record on the strip, as well as the heart rate, and we'll talk about that next. But just remember, the little tiny boxes are how many seconds? That's right, 0.04. And then the intervals, the 3 intervals I'm trying to get to is, that's right, the PR interval, that's right, the QRS, width of the complex, and that's right, the QT interval. Good. So let's begin. Okay, the first thing we want to know is this rhythm regular? And what do we mean by that? We talked about counting, we'll talk about counting the heart rate by the P's and QRS, but what do we say that, what do we love more, the atria or the ventricles? That's right, the ventricles. Big hug, the ventricles, we love them because they are our main 2 pumps. We need them to survive. We lose our atria, yes, it's a situation that we need to deal with. However, it probably won't kill you. If you lose your ventricles, it probably will kill you. So we need to get on that and see that, hey, that's a big problem. So when we're looking at the regularity and the rate and those kind of things, we're really focused on the QRS complex because that represents the depolarization of the ventricles. And so we really need to make sure that's the one we're concerned about. So if we're saying, is this regular, I would count the number of boxes in between R to R, and so there's 5, 10, 15, 20, 25, and then I would go to the next set of RRs and see, oh, there's still 25, there's still 25, still 25, still 25. So that shows a regular rhythm. What you can do is take a piece of paper and do the mark where the R is on the first R that you see and mark where the second R is that you see on a piece of paper, and then take that piece of paper and match it to the following R to R and the following R to R and the following R to R. And if it fits in there within a box, then you're good. You would call that a regular rhythm. Is this rhythm regular? So we would look at this and we would say, right, that's correct. Yes, it is. Is this irregular? No, it isn't, because we can see that every R comes down after the 25 boxes. And so our next beat that we would assume would come at that time. If it didn't, then we would say, hey, that's an irregular rhythm. If it does, which this one does, it's regular. Are there any, if you do see something that's irregular, is there any patterns to that? So like it goes along being regular for 2 beats, and then every 3rd beat it comes early where it's irregular. Then we would say there's a pattern to that every 3rd beat there comes. Or is there any extra beats? Is there anything that's showing up that's not the P, QRS, or T wave? And so this case, this rhythm is regular. Now rate, what is the rate? There are several ways to count the rate, and we'll go over each one of those. But the thing that we would look at is there's an atrial rate and the ventricular rate. Is there a P with every QRS? I look and see, yes there is, so that means it's a sinus rhythm. Is the rate in between 60 and 100? And so 60 and 100 would be normal. So that would be called a normal rhythm. And there's a P with every QRS, that's a sinus rhythm. So it's a normal sinus rhythm. So I could write NSR, and then we'll get into the rate in the next slide, but NSR would be normal sinus rhythm, and it is regular at this point. Good. Okay. One of the methods of counting the rate is we'll have to say, hey, this is the number of R waves in the 6-second strip. So first of all, we have to find 6 seconds. So what is 6 seconds? So remember, the little tiny boxes are 0.04. That makes up a larger box. 5 of those make up a larger box, and that would be 0.20. So 0.20 or 20, 40, 60, 80, and 1 second would be 5 of the larger boxes. Does that make sense? So you have 5 little tiny boxes make up a bigger box, and then 5 of those larger boxes make up 1 second. So we count, and you can see down at the bottom of the strip, you see a little mark where it's marking 1 second. As a little mark. You go to the second mark, that's 1 second. To the third mark, that's 2 seconds. Fourth mark, 3 seconds. 4 seconds, 5 seconds, 6 seconds. So I count within that 6-second strip. Now on the test, if I say this is a 6-second strip, then you don't have to count the boxes and everything, but you can just say, okay, that's a 6-second strip, so I'll count within that deal. There'll be times on the test, though, I will ask you to determine what the 6-second strip is, and you will have to know how to count the boxes to determine what is the 6-second strip. So in this case, it's a little bit longer than 6 seconds, but we've marked it out, and so we know where our 6 seconds are. And so the book says to count by intervals, like you go R to R to R to R and count, but I really believe that that's an error. Since books started coming out in 2013 and on, they use the method of number 2 where they use intervals, and I think that just got ascribed to the first way of doing it, because if you count these, this is the heart rate is 60 seconds, but if you use intervals, it would turn out to be a heart rate of 50, and so that's way off from what it is. Even using the other methods, it shows that the more accurate way of doing it would be counting the R to R and not by intervals. You use other intervals, you use intervals in the other methods, but you do not use intervals by counting the number of R waves in the 6-second strip. So despite what your book says, what I would like you to do is count the number of R waves within the 6-second strip. So you count 1, 2, 3, 4, 5, 6, and you multiply that by 10 because this is 6 seconds. So we need to get 60 seconds or a minute because your heart rate's in minutes. So if I say you have a heart rate of 70, what do I mean? Beats per, that's right, minute, beats per minute. So this is just kind of a snapshot of what's going on. Hopefully we'll get a 6 seconds that's representative of your heart rate. And what we're going to do is then do what? Count the R waves. That's right. So we count this and we get 6 and we multiply that by 10 and it gets a heart rate of 60 beats per minute. So what I would write from the previous page, normal sinus rhythm, NSR 60, and then a PR interval would be next, and QRS complex would be next, and then the QT interval. But right now we're just doing the counting the rate. So one method is to count the number of R waves in a 6-second strip. Now this works if the heart rate is regular or irregular. A second method would be count the number of larger squares between 2 consecutive R waves. So I pick 2 R waves and I count the larger boxes, 1, 2, 3, 4, 5 in between them, and take that into 300. So 300 divided by 5 large squares equals 60. So 60 beats per minute. So that comes out exactly with our first method. Okay, a third method is to take a larger square and say, okay, if the R wave showed up, the next R wave showed up right after the larger square, then the rate would be 300. If it took 2 squares, it'd be 150. If the R wave showed up at the third larger square, it would be 100. 4 squares would be 75, and then 5 squares, which is where R wave is, 5 squares equals 60 beats per minute. And as you start getting slower and slower in the heart rate, it starts getting into uneven numbers, 50, 43, and those kind of things. But we're going to just focus on this, so that if you do use this method, this large squares, you would just memorize that if it came after the first box, 300, 150, 100, 75, and 60. So that's just something that may be a little bit too complicated to memorize, and why do you have to when you can just count the R waves? A fourth method is to count the smallest little boxes, the tiniest little boxes, which is how many seconds? That's right, 0.04 seconds. And you count those in between 2 R waves. So you count 5, 10, 15, 20, 25. And you divide that by 1,500, because there's 1,500 small boxes in a 6-second strip. And so that's 1,500 divided by 25, and that equals 60. So all of these methods are getting us the same answer, roughly 60 beats per minute. Okay, so what we see here is that we're going to talk about the PR interval and QRS complex, and then the QT interval. So what have we got up to this point? We've got NSR 60, and now we're going to do the PR interval. So let's just talk about for a second, what is normal? A normal heart rate is 60 to 100. So we've talked about that. Normal sinus rhythm. Sinus is what? That's right, a P with every QRS complex. And is this regular rhythm? Yes, it's a regular rhythm. So we have a normal sinus rhythm, rate is 60, and then now we're going to do the PR interval. So how do we do the PR interval? We begin, it's an isometric line, straight, and then when it starts starting up, you'll see it kind of thin a little bit. It starts upward, and that's our beginning of our P wave. And the P wave represents what? That's right, the depolarization of the atria, which we have a little bit of love for, but we're really worried about the ventricles. So the P wave here, we're going to begin at it, and a lot of students will just measure the P wave, but that's not what we're doing. What are we doing? We're doing the PR interval. So the P to the beginning of the QRS complex. And I know it's PR interval and not PQ interval, but some patients are not going to have Q waves. Remember, we talked about that. A Q wave is the first line that goes down. Well, what if your patient's line doesn't go down? Well, technically there's not a Q wave there, but we would still call that the QRS complex. So it's beginning of that QRS complex. You just have to see that as one deal, and you go from the P to the beginning of the QRS complex, the beginning of the P wave to the QRS complex. And that normal interval should not be more than 5 boxes. And so we stretch out our hand. We have that kind of our gang sign saying, 5 fingers show me 5 boxes from the P to the QRS complex. If it's more than that, then it would be extended, or something's blocking that, or something's occurred, damage or something has occurred that we don't know, that is extending the normal time from the SA node to the AV node. So we're going to measure this PR interval and see how many boxes we get. Well, it starts in the middle of a box. So what we'll do is go 1, 2, 3, 4, and we see that 4 whole boxes and a half a box. So 4 times 4 is 0.16, because it's 0.04 for every little tiny box, and we multiply that by 4. That's 0.16, but we're going to add half of a box and make it 0.18. So we're going to put my PRI, or my PR interval, is 0.18. Now if you want to go with 0.20, or 0.16, that's your prerogative, but we'll want to get it as close as possible to that, so that the next person, if they sit down and did it, they would get closest to what we're getting. So as close, I think, that we can get would be 0.18, where we're kind of dividing half of a box to start out with. Okay, and then we could do that and check the PR interval, make sure it's okay on other ones, make sure that that's correct. That's what I'm getting with all the other ones. And so my PRI, I'm calling 0.18. Is that what you got? Good. Okay, and then the QRS complex, we're going to measure from the beginning of the Q wave when it first starts to go down, or if you don't have a Q wave, when it first starts to go up. So the QRS complex, we're going to beginning of that to the end of that, and I'm getting about 2.5 boxes. I mean, you could call it 2 boxes, but it goes a little bit into that third box. So if I just call it, I could call it 0.08, or I could call it 0.10. That would be up to the individual practitioner to say how close is that to that. Some people would call that 2 boxes. Some people would say that's 2.5 boxes. So if we called a review, it would be normal sinus rhythm, NSR 60, PRI is 0.18, QRS 0.10. And then we would also do the QT interval, the beginning of the Q to the end of the T wave, and that's how many boxes there. We've got 5, 10, and 11. So that would be 0.44, and we're saying, okay, that's normal is about 4 boxes, or 40, 0.40, and this is just a little bit over that. We might be a little concerned about that if a patient's getting medications that would prolong the QT interval. So those are our 3 things we're going to measure: the PR interval, the QRS complex, and the QT interval. And so now we have the rate, what kind of rhythm it is, normal sinus rhythm, the rate, the PRI, the QRS, width, and the QT interval. Now the QRS complex, if it's greater than 0.12, then I know that the stimulus is coming from lower than the atria. And so that's one thing that's going to be in our consideration. If it's widened QRS complex, we're going to say that stimulus is coming from the bottom part of the heart versus coming from the top part of the heart. And so that's a big point for us if the QRS is widened. And in this case, is it widened? Right, it is not widened. It is narrow complex. Okay, so we have a normal sinus rhythm rate of 60, PRI is 0.18, QRS is 0.10, and QT interval is 0.44. Okay, so I would like you to do what we just did together, but on your own. So I'm going to give you a few minutes here to just kind of look at this and answer these questions. First, how do you find the 6 seconds? Then count the rate using one of the methods we talked about. Tell me whether it's regular, is it sinus, what's the PRI, what's the QRS, width, and what's the QT interval. And I'm going to give you a few minutes to do this. And if you're having problems, just go back and see what we're doing. First, we're counting the little tiny little boxes to figure out how many 6 seconds is. Then we're going to count our rate. Then we're going to say, is this regular? Is this a sinus rhythm? Is it normal? Which you'll know by the rate. Write down the rate, tell me the PR interval, QRS complex width, and the QT interval. I'll give you just a little bit longer. Okay, I'm going to give you about 10 more seconds and then we'll stop and move on. Good job, guys. Okay, well, we're going to put all this together and we're going to talk about the rhythm interpretation when we have groups of rhythms. They're going to be categorized in too fast, and is it from the atrias, and then too fast from the ventricles. We're going to have too slow, and we'll talk about the blocks, and then we'll talk about dead rhythms. And these lists out all of the different rhythms. It doesn't list out all the atrial rhythms. We'll get into that in the next section. It doesn't list the ventricular rhythms. It does list the blocks and the dead rhythms, and then we'll get into each one of these and kind of look at these and show our interpretation. Again, is this a narrow complex narrow complex rhythm? It means the stimulus is probably coming from the top part of the heart. If it's a wide QRS, which is more than what? That's right, the 3 boxes. And then it would be stimulus would be coming from the ventricles. So we'll look at that. Also, I want to remind you to say, does this patient have a pulse? When we get into the dead rhythms, you can have rhythms and have no pulse and be dead. So it's very, very important that when you see a rhythm, that you're not just treating the monitor, but you're treating the condition of the patient. Have I checked the patient's responsiveness? Have I checked for a pulse? Is the patient talking and doing things? If they are, then I'm pretty sure that they're not dead. If they're not doing those things, then I need to be getting some help and classify this as a dead rhythm. So checking the pulse is very important, seeing how the patient condition is. Let's not forget the patient, because the patient is the whole point that we're trying to help is not learning about technology, not learning about these other things, but the whole point is to do all this so we can help the patient. Okay, and then a couple of other rhythms I just want you to be aware of is it may play into the role of tachycardia, but you might see it in bradycardia, you might see it in any rhythm, is 2 groups we would see is when we're measuring is this rhythm regular? So we take R to R, and whoops, there's a beat that came early. So we call that a premature beat. Now, is it premature atrial contraction or is it premature ventricular contraction? So we first look and see, it looks like it does have a P wave. And also, what did we measure? The QRS complex, and it is narrow. It's just a couple of boxes. So this would be a premature atrial contraction because the stimulus is coming from the top part of the heart. Now, otherwise, it looks regular, so this just may be one beat. It's not uncommon that people walk around having PACs, and there may not be anything wrong with that. But it shows in 2 different leads. We see it in lead 2 and MCL1 that we say, hey, we see this PAC showing up, and we can see it's a narrow complex beat, but it increases the heart rate just for a little bit, and then it kind of resets. So there's maybe a pattern to this if we'd see more of this rhythm strip. But we still would want to go and check our patient and say, hey, what's the patient's blood pressure? What's the patient's level of consciousness? What's going on with the patient? How are we doing? How is the patient doing? So there's PAC is one extra beat that you may see. And the last one would be, we would look again at the rhythm and say, hey, it looks pretty regular, but hey, then we have a premature beat. Is this a ventricular beat? Is this an atrial beat? Now there's no particular, I don't see a P wave with that widened beat, and I see it again. So I know that it's widened because the QRS is widened with that third beat, and then it repeats itself. So I know this is coming from the ventricles because it's got a widened QRS and no P wave. So this is a premature ventricular contraction, or a PVC. So you may hear that term, or you may have heard that term, PVCs, patients having PVCs. If there's a run of 6 of them in a row, it's considered VTAC. If it's less than that, it's just considered patients having frequent PVCs. Now you could say, like every other beat, a PVC happens. That's called bigeminy. Every third beat, you could say that's trigeminy. So you may hear those terms. This is unifocal PVC, meaning that it's the same shape when both of them occur. If it was multifocal, meaning it looks a different shape every time, like one's upright, maybe the other one's inverted or below the isometric line, then we would be a little more concerned. That would be a higher priority seeing the patient. Which would be the highest priority seeing the patient with PVCs or a patient with PACs? That's correct, a patient with PVCs. And who would be the highest priority to see, a patient with multifocal PVCs or unifocal PVCs? That's correct. Multifocal PVCs increases the risk of poor outcomes with the patient. So good job. And here again, I'm going to just give you a few minutes to try and reflect on what's been taught. I would like you to be able to teach this to somebody else and make sure you have this. So I'm going to give you a few minutes to write this out on a piece of paper and teach it back to me, or teach it to somebody that you know. Good. Keep going. I'll give you about a minute more. All right, guys, we'll just go ahead and wrap this up. You guys have done a great job. Thank you.